Your blood pressure medication is working. Your doctor checks your numbers and tells you everything looks fine. So you leave that appointment feeling safe, and that feeling of safety may be the most dangerous thing about your situation right now. Here is what nobody is telling you. It is not your average blood pressure reading that damages your arteries after 60. It is the spikes, the sudden, sharp jumps that happen between your checkups, during your regular daily life, and even while you sleep. I have spent years going through cardiovascular research and reviewing health outcomes in people over 60. Not people who ignored their health. People who took their medication every single day, showed up to every appointment, did everything right, and still ended up facing a stroke or heart failure that nobody saw coming. Because one critical piece of the picture was never explained to them. After 60, your arteries are working with a serious disadvantage. The elastin fibers inside your blood vessel walls, the fibers that allow your arteries to stretch and absorb a pressure surge, have stiffened. When a spike hits a young artery, it flexes. When that same spike hits an artery after 60, it pushes back against a wall that has very little give left. Every spike becomes a force event. And at the same time, your body's internal pressure regulation system slows down with age, which means it takes much longer to bring that spike back under control. 5 minutes of high pressure in a young artery is nothing. 5 minutes in an aging artery, repeated daily, is damage that builds quietly over years. There are 5 specific spike patterns responsible for this, ranked from quietly harmful to the one most cardiologists now consider the strongest early warning sign of stroke and heart failure in seniors. Number 1 is happening to millions of people every single night, completely undetected. Before we get into the list, drop a comment right now. Do you monitor your blood pressure at home, rely only on your doctor's office reading, or honestly haven't checked it consistently in months? Your answer is going to matter in about 2 minutes. Most seniors think of cold air as a comfort issue. Put on an extra layer, grab a heavier coat, and you are fine. But what is actually happening inside your blood vessels the moment you step out into the cold is something your doctor has almost certainly never walked you through. Think about your typical morning. You wake up, get dressed, and head outside to pick up the newspaper, walk to your car, or take your usual morning stroll. It feels completely normal. It feels healthy, even. What it actually is, for anyone over 60 with stiffened arteries, is a cardiovascular stress test, and most people are taking it every single morning without knowing it. Here is what happens the moment your body meets cold air. Your blood vessels in your skin and limbs clamp down almost immediately. This is your body's automatic response to preserve heat around your vital organs. In a younger person, this adjustment happens smoothly and the rest of the cardiovascular system compensates without missing a beat. But after 60, with arterial walls that have already lost much of their flexibility and a regulation system that responds more slowly, that sudden clamping down can push your systolic blood pressure, your top number, up by 20 to 30 points within just a few minutes. And this is happening before your morning medication has fully absorbed into your system. Before your body has had time to fully wake up. Right in the window when your blood pressure is already naturally rising on its own as part of your morning cycle. Research published in the journal Hypertension found that cold weather exposure meaningfully raised the risk of morning cardiovascular events in older adults, with the greatest danger concentrated in the first 2 hours after waking. That is not a coincidence. That is 2 pressure forces hitting your arteries at the same time, your natural morning rise and a cold-triggered spike on top of it. Now here is the part worth paying close attention to. That dull pressure you sometimes feel behind your eyes on a cold morning walk. The slight shortness of breath when you step outside in winter and feel like the air has hit you hard. Most people dismiss this as simply feeling the cold. What it may actually be is your blood pressure spiking in a way your body is struggling to bring back under control. The fix here is straightforward. Give yourself a 10-minute indoor warm-up before heading into cold air. Light movement around the house, a warm drink, anything that allows your cardiovascular system to reach its full waking function before it faces that cold weather trigger. And if you take blood pressure medication in the morning, it is worth asking your doctor specifically whether your current dosing time gives you adequate coverage during this early morning vulnerability window. But the next spike pattern is one that happens every single day after a meal, and it is doing something to your blood pressure that most people have never been warned about. Nobody thinks of sitting down to lunch as a cardiovascular event. You eat, you rest, your body does what it has always done. It feels like the most natural thing in the world. And that is exactly why what happens to your blood pressure after a meal is one of the most overlooked spike patterns in seniors over 60. When you eat a large meal, your body immediately redirects a significant amount of blood toward your digestive system to handle the work of breaking down that food. In a younger person, the rest of the cardiovascular system quietly adjusts, blood vessels elsewhere tighten slightly to keep the pressure stable, and everything stays balanced. After 60, that adjustment happens much more slowly. So instead of a smooth redistribution, you get a drop in blood pressure first as blood rushes toward the gut, followed by a sharp spike as the body scrambles to overcorrect and bring the pressure back up. Then a second correction. Then stabilization. That back and forth swing, down, then up, then down again, happens 3 times a day, every single day, in a pattern that stresses your arterial walls in a way that is just as damaging as sustained high blood pressure, only through a completely different mechanism. Here is what makes this particularly important. The blood pressure reading your doctor records at your checkup is almost certainly taken before a meal, or well after one. It is never capturing what your arteries go through in that 30 to 60 minute window after you finish eating. The reading that goes into your chart is not the reading that reflects what is happening to your vessels at the most vulnerable point of your day, 3 times a day, every day, year after year. A study published in the Journal of the American Geriatric Society found that this kind of post-meal blood pressure variability in adults over 65 was significantly linked to a higher risk of silent cerebral infarcts. These are tiny, symptomless strokes that do not show up as a dramatic event. They accumulate quietly on brain imaging over time and gradually chip away at memory, mental sharpness, and cognitive function, and most people never know they are happening. That tired, foggy feeling you sometimes get 30 to 45 minutes after a heavy meal? Most people assume it is just digestion slowing them down. In many seniors, what it actually reflects is the blood pressure drop phase of this swing, the brain receiving slightly less blood flow than it needs while the body is busy redirecting resources toward the gut. The correction here is practical. Smaller, more frequent meals rather than 2 or 3 large ones spreads the digestive demand and reduces the severity of the swing. A gentle 10-minute walk after eating, not exercise, just movement, helps your autonomic system normalize the pressure curve. And reducing high glycemic foods like white bread, white rice, and sugary drinks specifically at mealtimes matters, because high glycemic meals amplify this postprandial swing more than almost any other dietary factor. Stay with me, because the next one is the one that will genuinely surprise you, a false sense of safety built directly into the system most people trust most. If this is landing for you, drop a comment below and tell me where you are watching from. I read every single one, and I genuinely want to know who I am reaching today. Because what I am about to share is the one that stops most people cold. And it is this: the blood pressure reading your doctor records at your checkup may not be protecting you. It may actually be giving you a false sense of safety that is more dangerous than knowing the truth. That sounds like a serious claim, so let me explain exactly what it means. Your office reading is the number that goes into your chart. It is what your doctor uses to decide whether your medication dose is right, whether your treatment plan is working, and whether you are considered controlled. The entire system is built around that number. So it is completely reasonable to trust it. Most people do. Most people have no reason to question it. But there is a condition that cardiovascular researchers have documented and named masked hypertension. It describes exactly what the name suggests. Blood pressure that appears normal or borderline inside a clinical setting, but spikes significantly during regular daily life, during physical effort, during stress, during your morning routine, during the emotional moments of an ordinary day. Here is the part that makes this particularly relevant after 60. In younger patients, the opposite pattern is more common. People get nervous in the doctor's office and their reading goes up. But after 60, that effect often reverses. The calm, controlled environment of a medical appointment can actually produce a lower reading than what your arteries are handling for the other 23 hours of your day. Your medication may be dosed based on a number that only exists in that room. The damage is being done by numbers your chart has never once recorded. A meta-analysis published in the journal Hypertension, covering more than 11,000 patients, found that masked hypertension carried a cardiovascular risk nearly as high as sustained hypertension, and significantly higher than normal blood pressure. The patients who knew they had a problem were in a safer position than the ones who believed they did not. Knowing the truth, even a difficult truth, is protective. Believing a reassuring number that does not reflect reality is not. Here is how this shows up in real life. If you are currently on blood pressure medication and you still wake up with morning headaches, notice occasional blurring in your vision, or feel a low-grade tiredness that gradually lifts as the day goes on, those are not random symptoms of getting older. They may be signs that your medication is dosed for a reading that does not reflect what is actually happening inside your vessels. The fix is straightforward. Monitor your blood pressure at home, at the same time each day, ideally once in the morning before taking any medication, and once in the evening before bed. Use a validated upper arm cuff, not a basic convenience device. Track 7 consecutive days of readings and bring that record to your doctor. For anyone over 60 managing blood pressure, this is not extra information. It is essential information. Now we are moving into the territory that most cardiologists consider the more serious end of this conversation. The next spike pattern involves something that happens in seconds, and does damage that accumulates for years. Now we are getting into what cardiovascular researchers point to when they talk about the spike patterns most directly linked to acute cardiac events in seniors over 60. Most people understand that anger and anxiety are not good for the heart. But understanding it in a general way and understanding exactly what is happening inside your arterial walls in those moments are two very different things. Because the mechanism here is specific, it is physical, and it has two separate phases, and the second one is the one almost nobody knows about. The moment you experience a sudden surge of anger, anxiety, fear, or even intense excitement, your body releases a flood of stress hormones, primarily adrenaline and noradrenaline. These hormones cause your blood vessels to constrict and your heart rate to climb within seconds. Your systolic blood pressure can jump 30 to 50 points in under a minute. In a younger artery that still has good flexibility, that surge is absorbed. In an artery after 60 that has already stiffened, that surge hits the inner lining of the vessel wall, a delicate layer called the endothelium, with significant physical force. That force creates tiny microtears in the vessel lining. Your body then launches an inflammatory response to repair those tears. And that repair response, repeated over time, is one of the primary ways that arterial plaques form and gradually grow. The emotion passes. The structural consequence does not. But here is the second mechanism, the one that most people never hear about, and the one that makes this spike pattern particularly damaging after 60. The pressure spike does not end when the emotion ends. Research published in the journal Circulation found that blood pressure remained elevated significantly longer in adults over 65 following an emotional stressor than it did in younger adults. The reason is the baroreflex, the body's internal system for bringing pressure back down to normal after a spike. After 60, that system is slower. So the actual damage window is not the 2 minutes of the argument, the stressful phone call, or the upsetting news. It is the 20 to 40 minutes of elevated pressure that follows, while your body slowly works to bring things back under control. In reviewing senior health research, one pattern appears consistently. Seniors who were carefully managing their blood pressure, eating well, exercising, taking their medication, were still experiencing episodes of brief chest tightness or a sudden sense of pressure in the chest. These episodes were almost always connected to something emotionally stressful. They were almost always dismissed as anxiety. But the trigger was emotional and the mechanism was arterial. The two had simply never been connected for those patients. The fix here is not about avoiding emotion. That is neither realistic nor the point. What the research supports is a specific 10-minute practice immediately after an acute stressor, slow breathing in through the nose for a count of 4, and out for a count of 6. This breathing pattern directly activates the part of your nervous system responsible for bringing your heart rate and blood pressure back down, and research shows it meaningfully speeds up baroreflex recovery in older adults. This is not simply a relaxation technique. It is a deliberate vascular recovery practice, and that distinction matters when you understand what is happening in your arteries during those 20 to 40 minutes after the stressor has passed. And now, the one that has been building since the very beginning of this video. The spike pattern that happens to millions of people every single night, with no symptoms, no warning, and consequences that stack up every single morning they wake up completely unaware. This is it. This is the pattern that no standard checkup measures, that most people have never heard named, and that cardiovascular researchers now consider one of the strongest single predictors of stroke, heart failure, and kidney damage after 60. Your blood pressure was never designed to stay the same around the clock. Healthy blood pressure follows a natural daily rhythm. During sleep, it is supposed to drop between 10 and 20% below your daytime levels. Researchers and doctors call this the nocturnal dip. And this drop is not a minor detail. It is the window during which your heart gets to rest, your arterial walls begin to repair the wear from the day, and your entire cardiovascular system recovers and resets. It is, in many ways, the most important phase of your cardiovascular day, and it happens while you are completely asleep and completely unaware of whether it is actually occurring. In a significant number of adults over 60, this dip stops happening. Blood pressure stays elevated straight through the night. The heart never gets its rest period. The arterial walls never get their repair window. What you end up with is 8 hours of uninterrupted pressure, night after night, week after week, quietly accumulating damage in vessels that are already working under the disadvantages of age. A landmark study published in the Journal of Hypertension followed more than 3,000 patients and found that people whose blood pressure failed to drop normally during sleep had significantly higher rates of stroke, cardiac events, and organ damage compared to those whose pressure dipped as expected, even when their daytime readings were similar. The difference was not what was happening during the day. It was what was happening at night. And a separate landmark finding from the MAPEC study added something that fundamentally changes how blood pressure management should be approached. It found that simply taking at least one blood pressure medication at bedtime rather than in the morning significantly improved nighttime pressure dipping and reduced cardiovascular events by more than 60% compared to taking all medications in the morning. Same medications. Same doses. Different timing. Dramatically different outcomes for the arteries. Here is the critical problem. Your daytime office reading tells your doctor absolutely nothing about what your blood pressure is doing while you sleep. The only way to capture your nocturnal pressure profile is through ambulatory blood pressure monitoring, a small portable cuff worn for 24 hours that records your readings automatically every 20 to 30 minutes, including throughout the night. This test is not experimental. It is not new. It is not complicated. And for adults over 60 who are managing blood pressure, it may be the single most important piece of cardiovascular information they do not currently have. Now here is how nocturnal non-dipping shows up in daily life, and why it so often gets missed. Waking up consistently tired even after 7 or 8 hours of sleep. Morning headaches that are there when you open your eyes but gradually fade within an hour of getting up. Blood pressure readings that are noticeably higher first thing in the morning than they are in the evening. These are not signs that you slept badly. They are not signs of stress or dehydration. Based on what researchers have documented, these are recognizable patterns associated with blood pressure that is not dipping during sleep, a slow, nightly cardiovascular event that leaves its fingerprints in how you feel every single morning. Before your next appointment with your doctor or cardiologist, write down one question and bring it with you. Ask, has my nocturnal blood pressure pattern ever been assessed, and given my current medication timing, should it be? If you have never had ambulatory blood pressure monitoring, that one question starts the conversation. If all of your blood pressure medications are currently taken in the morning, ask your doctor specifically whether moving at least one dose to bedtime is appropriate for your situation. The research supporting bedtime dosing is substantial, and for many seniors it represents a meaningful change that costs nothing extra and requires no new medication. Take a moment now to look back at everything covered in this video, because these 5 spike patterns are not 5 separate problems. They are 5 different failure points in the same underlying situation. Arterial walls after 60 that have less ability to handle pressure variation. A cardiovascular regulation system that responds more slowly. And a standard monitoring approach that captures only a small fraction of what your arteries are actually experiencing day to day. The morning cold spike, the post-meal pressure swing, the masked hypertension hiding behind a normal office reading, the emotional cascade that lingers long after the moment has passed, and the nocturnal non-dips silently running through the night. Not one of these shows up in a routine checkup. But all of them are acting on your arteries, every single day, building the kind of damage that eventually arrives without warning and gets called sudden. Now let us shift to what you can actually do beyond the standard protocol, not instead of your medication, but alongside it, filling the gaps that a prescription alone was never designed to cover. The first is magnesium glycinate, 400 mg daily. Magnesium plays a direct role in helping blood vessel walls relax. After 60, most people are not getting enough of it through food alone, and low magnesium levels make blood pressure harder to control and arterial walls more prone to tension. The glycinate form is important here. It absorbs significantly better than magnesium oxide, which is the cheap version found in most drugstore multivitamins and does very little at the level your body actually needs. The second is aged garlic extract. Multiple controlled research trials have shown that aged garlic extract produced meaningful reductions in systolic blood pressure in older adults with hypertension. Its effect works through supporting nitric oxide production in the body, which is a natural compound that helps keep arterial walls more flexible and relaxed. This is not a folk remedy. It has a genuine published research record and a long safety history. The third is dietary nitrates from beetroot, either through regular beetroot consumption or a standardized beetroot extract. Research published in the American Journal of Clinical Nutrition found that regular nitrate intake meaningfully lowered systolic pressure in older adults by supporting the health of the inner arterial lining. None of these replace what your doctor has prescribed. They address the biological gaps that medication alone was never built to fill. I want to come back to the kind of person this video was made for, because putting a face to this information is the whole point of sharing it. A woman in her early 70s. Retired. Careful about her health in every way that had ever been recommended to her. 8 years on blood pressure medication, consistent checkup readings that her doctor described as reasonable, low-sodium diet, daily walks. By every standard measure, she was doing things right. She came to the attention of cardiovascular researchers after experiencing a minor stroke with no obvious trigger and no warning signs that her standard care had flagged. A 24-hour ambulatory blood pressure monitor was ordered. Her nighttime profile came back as a confirmed non-dipper. Her blood pressure was averaging 15 points higher during sleep than during the day. 8 years of nightly arterial exposure that no office reading had ever captured. Her medication timing was reviewed and one dose was moved to bedtime. Magnesium glycinate was added. Her evening eating window was adjusted. Within 3 weeks, the morning headaches she had quietly accepted as part of getting older were gone. Follow-up cardiovascular assessment showed no new areas of concern. When asked how she felt, she said something simple that has stayed with me: "Nobody ever told me my blood pressure had a schedule. It does." And for millions of seniors managing their blood pressure faithfully every day, it is that schedule, not their compliance, that nobody has ever looked at. The issue was never that the treatment was complicated. It was that the full picture had never been seen. Here is the one thing I want you to do before anything else. Tonight, before you go to sleep, take your blood pressure and write the number down. Tomorrow morning, within 30 minutes of waking up and before you take any medication, take it again and write that number down too. Then compare the two. If your morning reading is consistently higher than your evening reading, that single pattern, something you can identify at home with a basic blood pressure cuff that costs around $30, is the beginning of a conversation your doctor needs to have with you. Not someday. At your next appointment. That one comparison, done consistently over a week, gives you more useful cardiovascular information than most people have collected in years of routine checkups. If someone you care about has been managing their blood pressure faithfully for years and still experienced a stroke that seemed to come out of nowhere, please share this video with them. The readings their doctor saw were probably within an acceptable range. It was the readings that nobody ever measured that were telling the real story all along. And if this video gave you something your last appointment did not, make sure you subscribe before you leave, because next week we are covering 5 symptoms that appear in your hands and fingers after 60 that researchers now recognize as some of the earliest visible warning signs of arterial disease. For years these were dismissed as simple circulation problems or early arthritis. Increasingly, the research is pointing to something far more specific. You will want to catch that one.